Today we will take a very new chapter that is the professional conduct, etiquettes, and the code of ethics. So this is a very new chapter to you, and here the certain rules and the regulations are explained of the general practitioner or the homeopathic practitioner. How the practitioner should behave in the society, what are his moral duties, how he behave with the patient. So all these things are given related to his profession, related to his etiquette and the ethics of code with the patient. How he should behave, how he should give the uh, respect to the patient. So all these things are given in this chapter, and with that, the most important is the oath that every physician is taking after the completion of his medical academics. So that oath is again is important, and it is taken by the registered practitioner. So in this professional conduct, etiquette and the code of ethics, we will see the 7 different points. So first one is the declaration and the oath. Second is the general principles. Third, duties of homeopathic practitioner with their patient. Fourth is the duties of practitioner to the profession. Duties of practitioner in consultation. Duties of practitioner to the public, and professional misconduct. So under these headings, we will see the certain etiquettes of the homeopathic physician. These regulations may be called the Homeopathic Practitioner Regulations 1982. So first of all, we will take the declaration and the oath. At the time of registration, each applicant shall submit the following declaration and oath. It must be properly read by that applicant, and it should be signed by the applicant, and it is submitted to the registrar concerned to the university, or it is concerned to our MCH. And so the oath is given in your book. So please read that oath carefully. जब आपको registration मिलेगा after your internship, so you have to submit this oath. So I solemnly pledge myself. So all these things to I will help the humanity. I will follow all the laws. I will treat my patient with my all humanity. I will maintain the utmost respect of the human life. Then I will not do any political belief. I will not do any politics with my patient. This is my whole and sole duty to treat the patient. I will do my practice. I will do my profession with my all loyalty and with my all the principles of the homeopathy that I have got it from the 4 years of my academic curriculum. Then the health of the patient is my first consideration. I respect all the things जो हमको केस हिस्ट्री में मिलता है उसका हम लोग रिस्पेक्ट करना चाहिए. I will keep all the things confidence with me regarding the patient, and most important is I will give the respect to my teachers and to my patients. And lastly, you are giving the gratitude to the teachers that they are giving the full knowledge of the homeopathic principle since first year to last year. So these are all the points are present in that pledge, so or the oath यू कैन से. सो दैट ओथ आपको ये लेनी पड़ती है, आपको उस पर साइन करना पड़ता है. व्हेनेवर यू आपको जब वो डिग्री मिलती है, आपको जब वो रजिस्ट्रेशन मिलता है फ्रॉम द MCH, सो एट दैट टाइम रजिस्ट्रार के पास आपको ओथ सबमिट करनी पड़ती है. सो हैनिमनियन ओथ भी एक है. सो on my honor I swear that I shall practice the teachings of homeopathy perform my duty, render justice to my patients, and help the sick whosoever comes to me for treatment. May the teachings of Master Hanuman inspire me, and may I have the strength for the fulfillment of my mission. This is the Hanumanian oath कि हम लोग हनुमान के सामने he is our God और वो गॉड के सामने वी हैव टू टेक द ओथ. सो दिस इज द हनीमनियन ओथ. सो दो oath we have to take. The first one is regarding to our profession, and the second one is the Hahnemanian oath. So you will get this all the things when you will get the registration number. Now we will take the first point, that is the general principles. So what are the general principles that the physician should follow regarding his profession? So first one is the character of medical practitioner. This is the foremost important thing, the character of that medical practitioner. The primary object of the medical profession is to give the better medicinal facilities to the patient with full respect for the dignity of the person. Financial reward is the subordinate consideration. You will get the money, but your aim should be the treatment of the patient. Whosoever chooses this profession assumes the obligation to conduct himself in accordance with its ideals. A practitioner of homeopathy shall be upright man, instructed in the art of healing. He shall keep himself pure in character, and he should care the sick person with the priority. He shall be modest. He should be sober. He should be prompt with the patient. He should not show any panic condition, or he should not have any anxiety in front of the patient. But at the same time, the practitioner has to give the prompt treatment to the patient. This profession and in all his action should be for the betterment of the patient. In this way, your character should be a pure one when you are treating the patient. आपके सामने patient ही रहना चाहिए, not the financial aim. Promptly, properly, when you and purely, when you will treat the patient, the money you will get it. पैसा कहीं नहीं जाने वाला है, but your character should be a prompt one. You should be with the all the genuineness, and you should be unprejudiced observer. This is the first general principle when you are behaving with the patient. Second is standards of character and morals. The medicinal profession accepts from its members the highest level of character and morals. The medical field is such a pure field, is such a क्या बोलते हैं उसको कि इट इज सच ए डिवाइन फील्ड है कि कभी कभी भगवान मानते हैं पेशेंट डॉक्टर को, फिजिशियन को. कुछ कुछ एक्सेप्शंस रहते हैं वो छोड़ के जो फिजिशियन है, जो डॉक्टर है, ही इज गिविंग द life to the patient, and hence the character should be of that much standard. He should have the certain morals in him, so that that physician will be act as an ideal in front of the patient. And every practitioner of the homeopathy owes to the profession and to the public alike a duty to attain such a level. तो हमने हमारे ड्यूटी से, हमारे क्या बोलते हैं उसको, हमारे बिहेवियर से we should have that we should attain that much standard. It shall be on the character of that homeopathic physician, how to or we can say ki, how you are behaving in front of the patient, that will give the character to you. And when you are behaving properly, yes, you will get the returns of it. So for the practice of medicine, it requires the clear mind, it require the vigorous hard work, and this require the promptness, nothing else. So this will give, so the physician should have a certain morals. He should have the basic concrete, I have to treat the patient very nicely, and then only he will get a standard character. The third thing he required, that is the practitioner's responsibility. He should know his responsibility. So in the practitioner responsibility, a practitioner of homeopathy shall merit the confidence of patients entrusted to his care, making him to each full measure of service and devotion. So he should build a confidence with the patient that he will do all the things for the patient. He is doing the all the things right and which are beneficial to the patient. And the honored ideals of the medical professional imply that responsibilities of a practitioner of homeopathy extend not only to individuals but also to the entire society. So this is our prime responsibility. We should develop that much trust with the patient. We are doing the best to him, and this message is not only for that individual, it is for the entire society. So it is extending now from individual to the society. The next thing is the advertising. The solicitation of patient directly or the indirectly by a practitioner of homeopathy, either personally or by advertisement in the newspapers, or the by distribution of the certain cards or the handbills, is unethical. We should not advertise by such way. A practitioner of homeopathy shall not make use or permit others to make use him or his name as a subject of any form or manner of advertising or publicity through any channel which shall be such a character as to invite attention to him or to his professional position or skill, or as would ordinarily result in his self advertisement, provided that the practitioner of homeopathy is permitted formal announcement in press about the following matter. So he should not advertise about his skill. I am very much good in XYZ. I am very much good in the hair fall. I am very much good in the vitiligo. Or so many practitioners are doing the advertisement. So this is the unethical. This should not be done by the homeopathy, because we are treating the patient as a whole. Holistic approach is our cardinal principle. If you are advertising yourself, I am a specialist in the hair fall, or I am a specialist in the skin specialist, so it is totally um, in the opposite to that of the laws of homeopathy, and hence we should not advertise in such a manner through any channel, through any handbill, or through any circulating any cards, by any advertisement. We should not do this. What we can do, we can give the advertisement that in such a way that we asked, I am starting a practice, or in this this is my area for the practice, or if you are changing the place of your practice, at that time again you can give the information so that the patient will get the new address, or the change of the timing, or the temporary, or you are out of station, or you are not feeling well, at that time you can give it temporarily, I am absent from my duty. Or the when you are come back rejoining your duty, that also you can explain. Or succeeding to another's practice, you if you are going out of the city or out of the country because of the some reason, and you are handovering it to the another physician, that also you can do in the advertisement. But you should not advertise or you should not do any publicity of your skills. You should not do any propaganda of your what you can say, your overconfidence. So this is totally unethical कि मैं इसमें बहुत अच्छा और मैं ये बहुत ट्रीट करता हूँ और मैं किडनी स्टोन गिरा देता हूँ एंड आई कैन ट्रीट द रूमेटॉइड आर्थराइटिस एंड आई कैन डू द osteoarthritis very well in a 1 month and बहुत पुराने पुराने रोग में ठीक करता. This should not be the attitude of the homeopathic physician. This is totally unethical. So these are the points only where you can do the advertisement. If you are changing your place, changing your time, if you are absent for some days, if you are starting a new practice, this can be a ethical one. Otherwise, my the showing of your own skill, this is the unethical. Then he shall further not advertise himself directly or indirectly through price list or publicity material of manufacturing firms or trader with whom he may be connected in any capacity, nor shall he publish cases, operations, or letters of thanks from patient in non-professional newspapers or journals, provided it shall be permissible for him to publish his name in connection with prospectus or the directors or technical experts report. Nowadays this is happening every day कि कोई ना कोई फिजिशियन उठ के बोलता है कि गिव दिस मेडिसिन फॉर द कोरोना, दिस विल गिव द बेस्ट रिजल्ट, और गिव दिस मेडिसिन फॉर द those ladies who cannot bear the child. So these are or the infertility we can say. So you आपने भी ऐसे बहुत सारे सोसाइटी में देखे होंगे कि that is a skin specialist, homeopath but skin specialist, और the homeopath but a specialist in the chronic diseases. हैंडबिल्स में आता है या टीवी पे भी जब आप चैनल ऑन करते हो तो उसमें भी बहुत सारे पब्लिश करते हैं लोग. सो दिस इज टोटली अनएथिकल. दूसरा जो है कि मैंने ये केस ट्रीट की, मैंने वो केस ट्रीट की, मुझे ऐसा रिजल्ट मिला, मुझे वैसा रिजल्ट मिला, ये नॉन मेडिकल जर्नल में पब्लिश करना या कहीं पे भी पेशेंट 10-12 पेशेंट बिठाना और अपने ही बोलते रहना कि मैंने ऐसे पेशेंट ट्रीट किए हुए. सो दिस इज टोटली अनइथिकल. हाँ, if you are attending the medical seminars, if you are attending the medical conferences, if you want to publish your success case history in the medical journals, and it is okay because it is beneficial to the next generation or it is beneficial to the medical students. If you are publishing in a medical field, it is okay, but it should be published in the non-medical journals or the non-medical जो लेमॅन है उनके सामने खुद का ही म्हणजे आपण म्हणतो ना मराठीत फुशारकी मारणे, तो ते करायचं नाही. यू शुड नॉट ॲडव्हर्टाइज युअर स्किल, यू शुड नॉट ॲडव्हर्टाइज युअर फेल्युअर केसेस और द सक्सेस रेट्स ऑल्सो. जो भी कुछ करना है इन आवर फील्ड, यू डू इट. यू पब्लिश योर सक्सेस केस, सक्सेस स्टैटिस्टिक्स, जो भी कुछ करना है. देयर सो मेनी मेडिकल जर्नल्स आर प्रेजेंट. जो भी आपका रिसर्च हुआ है, यू पब्लिश इट इन द मेडिकल जर्नल्स, नॉट ऑन द नॉन प्रोफेशनल थिंग्स. So this is that these 2 points regarding the advertisement are very important. First, you should not advertise your skill because it is totally unethical. Because we are following the holistic approach. Only when we are saying that I am specialist in this XYZ field. So this is totally opposite, or this is totally will give the wrong direction to the homeopathy. And second thing is that do not advertise your capacity in front of the non medicos. So these are the 2 things are important in the advertisement. The next thing is the payment of the professional services. A practitioner of homeopathy engaged in the practice of medicine shall limit the sources of his income to fees received from professional activities for services rendered to the patient. एक बात बताना है यहाँ पे, मैं फिर से भूल गई इन द एडवर्टाइजिंग में, ही शुड नॉट एडवर्टाइज अबाउट हिज चार्जेस कि मैं बहुत गरीब पेशेंट था इसलिए मैंने उससे 20 रुपए लिए, लेकिन वो पेशेंट बहुत ज़्यादा रिच था तो मैंने उससे 2000 रुपए लिए। दिस शुड नॉट बी द एटीट्यूड ऑफ द होम्योपैथिक फिजिशियन। उसने कहीं पे भी चार्ज, ये हमें दिखावा नहीं करना चाहिए। चार्जेस कहीं पे भी उसने लिस्ट उसकी पब्लिश नहीं करनी चाहिए। बट नाउअडेज ऐसा होता है कि some physicians they are taking the much more money from the patient, and that's why now the government says that you write the charges in your OPD. So it is a rule by the government nowadays कि आपका कंसल्टेशन फी जो है वो आपको बाहर एक इस पे लिखना पड़ेगा, डोर पे बोलो या फिर विंडो पे, कहीं पे भी जगह है। सो यू जस्ट स्टिक योर पैम्पलेट देयर, योर कंसल्टेशन फी। लेकिन वो जो फी का चार्ट है, इफ यू आर पब्लिशिंग इट इन द हैंडबिल और इन द जर्नल, सो दिस इज अगेन अनएथिकल। नाउ द पेमेंट ऑफ प्रोफेशनल सर्विस, जो भी आप एक्टिविटीज कर रहे हो, सो योर एम शुड नॉट बी टेकिंग द मच मोर मनी। यू आर टेकिंग द रेम्यूनरेशन, आपको जो मिलता है रिसीव फॉर सच सर्विसेज शैल बी in the form and amount specifically announced to the patient at the time the service rendered. In all other cases, he shall deem it point of honor to adhere to the compensation of professional services prevailing in the community in which he practices. So आपको community, आप कौन से community में practice कर रहे हो, according to that you have to take the remuneration. If you are practicing in a slum area and if you are taking the 500 rupees charges, this is again unethical. You should see which type of people are coming to you and take the fixed amount. You should not increase and you should not decrease it. So this is the payment of profit. You should be loyal to your profession. If you are taking 500 rupees from the lower middle class, then you have to take the same money from the रिच पर्सन ऑल्सो, कि वहां पे उसको बहुत पैसा दिखा तो आपने 2000 उसको बोल दिया. दिस शुड नॉट बी योर एटीट्यूड बिकॉज यू आर सर्विंग ह्यूमैनिटी. यू, दिस इज योर एम. To get the money, this should not be your aim. Then fees are reducible at the discretion of the practitioner of homeopathy, and he shall always recognize poverty as presenting valid claims for for the services. So मैंने जैसे अभी कहा कि if that patient is very poor, आपने उससे पैसा नहीं लिया तो भी चलता है, आपका कुछ भी नहीं जाने वाला. So according to the community, you have to practice, but you should have you should not ask them beyond the limit. If you, अगर आपकी कंसल्टेशन चार्जेस 200 रुपए है, so you from that poor person you take only 20-30 rupees or don't take the money. लेकिन if the rich person comes to you, your consultation is 200, don't ask him 500 rupees. It shall be unethical to enter into a contract of no cure no payment. So गरीब बेचारा पैसा नहीं दे रहा है तो आप उसको ट्रीट नहीं करोगे. This should not be your attitude. The next principle is rebates and commission. A practitioner of homeopathy shall not give, solicit or receive, nor shall he offer to give, solicit or receive any gift, any commission or any bonus in consideration for referring or recommending any patient for surgical or other treatment, nor shall he receive any commission or any other benefit from professional colleagues or dentist or the pathologist. This is known as cut practice. So cut practice, ये हमेशा will cut you very soon. हमेशा ध्यान में रखना, cut practice will cut you very soon. So what is this cut practice? If I am treating a patient and I want to do the blood test of that patient because he is having a low hemoglobin level. So what I will do, when I will get the symptoms of paleness or weakness or whatever may the symptoms of anemia, what I will do, I will ask that patient to do the hemogram or do the CBC. Then I will refer that patient to that particular pathology lab. ये XYZ pathology lab है, इसमें ही जाओ और इसमें ही आपको करना है. या फिर if that patient is having pain in abdomen, to confirm the diagnosis, I will ask that patient to do the ultrasonography of the abdomen, or do the x-ray of the chest, or x-ray of that particular joint. So all these investigation, for all this investigation, if I am referring to my colleague, or to my particular pathology lab, and if I am, when I am sending the patient to them, they will give the certain rebate to me, they will give the certain bonus कि मैंने अगर 10 patient भेजे, then I will give the 500 rupees per patient. I will give the 20% from the total patient. So this should not be the your attitude. हमको ये कट प्रैक्टिस नहीं करनी है. या फिर ऐसे भी कट प्रैक्टिस होती है कि पेशेंट को आंख में प्रॉब्लम है, तो मैं आंख के डॉक्टर के पास भेजूंगी, ही इज माय कलीग एंड ही और शी अगेन गिव मी द मनी. अगर उसमें दांत का प्रॉब्लम है, आई विल सेंड टू दैट पर्टिकुलर डेंटिस्ट ओनली, where I will get some commission. So this is known as a cut practice. सब एक तिल जो पांडवों ने 5 टुकड़े करके खाए थे, तो वैसे ही when the patient comes to you, तो आप उसको पूरा तरह से कट करके खा लेंगे. So this should not be your attitude. पहले मैं जनरल फिजिशियन, फिर उसके बाद डेंटिस्ट के पास, उसके बाद पैथोलॉजी वाला खाएगा, फिर उसके बाद एक्सरे वाला, उसके बाद स्पेशलिस्ट, उसके बाद सिटी स्कैन वाला. So this is a link and everyone is getting the money because of that general practitioner. So this cut practice is not allowed in the homeopathy or even in the medical field. And so this rebate and the commission is very much important point as that of the advertisement. Then the next is the duties of homeopathic practitioner with their patients. Duties of practitioner to their patients. So first one is the obligation to seek. Though a practitioner of homeopathy is not bound to treat each and every one asking for his services except in emergencies, he shall, for the sake of humanity and the noble traditions of the profession, not only be ever ready to respond to the calls of the sick and the injured, but shall be mindful of high character of his mission and the responsibility he incurs in the discharge of his professional duties. So this is his first duty and this is his obligation to treat the sick except in case of emergency. But he has to treat the sick in any condition. Emergencies means whenever there is a poisoning case, whenever the patient is under the asphyxia, drowning condition, where our medicine will take some time to act. They will act, but the situation is not like that. The condition of the patient is not, or the vital force is not ready to take some time. Very emergency condition which is fatal to the life. At that time, you refer that patient to the allopathic physician, and then afterward you can give your medicine. But these are only the exceptional cases in case of emergency. But after that, you are very much confident. You should be very much confident that you will treat that sick. So this is your obligation to treat the sick person except certain emergencies. Then next one is the practitioner's responsibility. A practitioner of homeopathy is free to choose whom he will serve, provided we shall respond to any request for his assistance in an emergency or whenever temperate public opinions experts the services. So this is our responsibility to serve or to take the assistance if you are required. Once having undertaken case, a practitioner of homeopathy shall not neglect that patient and should not withdraw himself from that patient. his relatives, or he is totally responsible for that patient, for his relatives, and he is totally responsible for that particular patient. He cannot withdraw, or he cannot take out the hands from that case. So this is our responsibility. Then termination of service. So there are the certain reasons that we can withdraw, but this is our obligation to treat the sick. Once you are taking the patient, this is your responsibility to treat that patient. You cannot withdraw, but in some cases you can terminate your service. For the say, for example, where the physician find another practitioner in attendance, दूसरा कोई उसको treat कर रहा है, then at that time you can withdraw. Second, where the remedies other than other prescribed by him are being used. जैसे मैंने उसको medicine दी, but he is not taking the medicine, he is taking the Ayurvedic medicine. At that time, there is no need to give the service to that patient. Third, where his remedies and instructions are refused. You ask that patient to do not take the ice creams, or do not take any cold food because that patient is having the tonsillitis, or you ask that patient to take the exercise, but he is not doing all the things repeatedly. If you are telling to that patient but he is neglecting, at that time, if you are, अगर आपकी कोई वैल्यू नहीं है आपके एडवाइस की, terminate your service. Where he is convinced that illness is an imposture and he is being made a party to a false pretense. जहाँ पे आपको लगता है कि आप ये केस नहीं ट्रीट कर सकते हो, this is beyond your limit, again you can terminate your service. Where the patient persists in the use of opium, alcohol, or similar intoxicating drugs against the medical advice. हम हमेशा patient को बोलते हैं कि when you are taking the homeopathic medicine, you should not take any tobacco or any alcohol, because this will causes the antidotal effect to our medicine. Our medicines are made by the alcohol, so if they are taking the alcohol in the larger quantity, so that will do the antidotal effect. हम कभी कभी कॉफ़ी या डिओड्रेंट या ये सब चीज़ें भी उनको बोलते हैं कि डोंट यूज़ इट, या फिर टैल्कम पाउडर जो ज़्यादा परफ्यूम वाली है. सो ऑल दैट यू विल वी हैव सीन इन द ड्रग प्रूविंग कि those drug substances or the drugs drug substances नहीं, food items कि herbs जैसे हमने देखा था, या he should not use the perfumes, क्योंकि वो क्या करेगा, because of his strong odor, because of his medicinal activity of the food substance, वो medicine को act करने नहीं देगा. इसलिए हम लोग coffee avoid करते हैं, certain herbs avoid करते हैं. Similarly, we are also avoiding the tobacco or the bidi or the cigarettes or the alcohol. All these things should be avoided by the patient. लेकिन patient वही बार बार ले रहा है, you can terminate your service. Where a complete information concerning the facts and circumstances of the case are not supplied by the patient nor by his relative, at that time also you can terminate your service. And if you think that the patient is incurable, the lots of pathological changes are there, at that time also, if it is beyond your capacity, you can terminate your service. So these are all the points where you are not obligated to that sick person. So first point we have seen, you are obligation to the patient, you are obligated with that sick person. And who is the sick person? Those are having the signs and symptoms, though you are not in a position to do the diagnosis. If he is having sign and symptom, he is the sick, and you have to treat that patient. This is your responsibility. Once you select that patient as a sick, this is your responsibility कि you should not withdraw, you should not terminate your service. But at the same time, we have seen that the certain circumstances are there where we can terminate our services. Next is the act of negligence. No homeopathic practitioner shall commit any act of negligence that he may deprive his patient of unnecessary medicinal care. So उसने उसको neglect नहीं करना है. He should give a proper medicinal care to the patient. A practitioner of homeopathy is expected to render that the diligence and skill in services as would be expected of another practitioner of homeopathy with similar qualification experience. So you should give the proper attendance or the proper attention to the patient. You should not neglect him. A practitioner of homeopathy shall use any drug prepared according to homeopathic principles and adopt other necessary measures as required. So आपने वो patient को attend करना है अच्छे से, उसको attention देना है. Then you should give a proper homeopathic medicine. You should not give any non-homeopathic, non-professional drugs to the patient, and you should treat that patient as the other homeopathic physicians are treating with proper knowledge. So if you are neglecting the patient, then this is the act of negligence. Next one is the behavior towards the patient. So this is our divine pathy, or this is a very divine profession. So in this, you should have a certain sympathy for the patient. You should behave friendly with the patient, and most with the positive attitude. You should help that patient very nicely, because the every patient wants the cure from you. Every patient shall be treated with the proper attention and the proper consideration. So in this way, your behavior matters very much when you are talking with the patient, when you are any doing any consolation to the patient, because the patient will also judge you कि how you are behaving with them, कि आप कैसे बात करते हो, या आप कैसे उनके साथ व्यवहार करते हो. सो द ऑल द पेशेंट्स विल सी जज यू कि आप केस हिस्ट्री कैसे लेते हो, आप कौन से क्वेश्चंस उसको उनको पूछते हो, हाउ यू आर मेकिंग द आई कांटेक्ट आप उनसे करते हो या नहीं करते हो, आप फिजिशियन पेशेंट को फाइनेंशियल पूछता है क्या. सो ऑल दिस थिंग्स दे विल आल्सो ऑब्जर्व, and hence your behavior should be proper with the patient. A practitioner of homeopathy shall give a very comfortness to the sick person, and in every visit he should give a proper time to that patient. जो पेशेंट को आपने टाइम दिया है, वो पेशेंट पे आपको वो फिजिशियन ने वो पेशेंट को देखना जरूरी है. अदरवाइज दैट पेशेंट विल बी फ्रस्ट्रेटेड कि मुझे टाइम दिया था और वो मुझे देख नहीं रहे हैं फिजिशियन. So in every visit you should attend that patient properly. Then the prognosis, the practitioner of homeopathy shall neither exaggerate or nor minimize the gravity of the patient's condition. Prognosis means the future of the that disease or the future of the patient. If that patient is having the simple cough and coryza, उसको आपको exaggerate नहीं करना है कि you may have a COVID. Just wait and watch, give the medicine. If the patient is not feeling better 2 to 3 hours or one day, then you ask that patient to do the COVID test. But if you are exaggerating that, this is totally unethical. Minimizing also, if that patient is having the fever, if that patient is having the breathlessness, and you are saying that no, you have to take my medicine only, don't go for that test, this is again not proper. So in a you should be behave properly. You should be a balance with your mind कि मुझे ये symptoms दिख रहे हैं, they are moving towards the COVID, so you should send him for the test. He shall ensure that the patient to the patient, to his relatives or any friends, that this is the condition of the patient, and we will do the best with that patient, and if required we will do this certain test, or ask them, the relatives or to the friend, do this test immediately because I am thinking like this, because of the condition of the patient and the condition of the disease. So this is the way of your behavior. In this way you should tell the truth about his prognosis. In cases of dangerous manifestation, he shall not fail to give timely notice to the family or to the friend or to the relatives of the patient, and also to the patient when it is necessary. If that patient is having a fatty liver, if that patient is having the cirrhosis of liver, or if that patient is having the kidney stone, then ask that patient to do not take the alcohol, do not use tobacco, do not use the cigarette, बिकॉज दिस विल अफेक्ट द हेल्थ ऑफ दैट पेशेंट. तो वहाँ पे आपको रिलेटिव्स को भी बोलने हैं कुछ चीज़ें और कुछ चीज़ें आपको पेशेंट को भी बोलने हैं. सो इन दिस वे you should be very clear, you should be crystal clear with the prognosis of the patient, with the relatives or with the patient himself. Then the patient's delicacy and secrecy. This attitude, that is the patience and delicacy, is very much important in our profession. The confidence is on the patient, it is very nice, but you should not be panic in every condition. You should have a faith on your medicine. If the patient comes to you with a pain in the abdomen, pain in the head, if all the parameters are within the normal range or in a physiological range, दो द पेशेंट तो पैनिक होके ही आपके पास आएगा, लेकिन पैरामीटर्स अगर नॉर्मल इसमें है, you just give our acute proved medicine and console the patient, give the confidence, give the positive attitude to the patient. So you should not be in a panic condition. Patient भी panic हो गया, doctor physician भी panic हो गया, so this will lost your patience. So you should not lose your patience. You should delicately handle that patient, and most important is you should have maintained the secrecy of the patient. पेशेंट को जो भी डिसीज है, इट शुड नॉट बी डिस्कस विथ योर रिलेटिव्स, विथ योर फ्रेंड्स और विथ योर फैमिली. This is very much importance. Otherwise, the patient will not give the confidence. The patient will not build confidence on you, and this will reflect your character. So, in the medical field, you should maintain the secrecy regarding the history of that patient. किसी के patient की history भी हम दूसरे patient के साथ या relatives के साथ हमको discuss नहीं करनी है. So these are the duties of practitioner to their patients. जो भी पेशेंट को डिसीज है या जो भी कुछ है, इट शुड नॉट बी रिवील्ड बाय द फिजिशियन टू द in front of the others. So these are the duties of the practitioner. So you are this is your obligation to treat the sick. This is our responsibility, but at the same time you can terminate your services at the certain point that we have discussed. There should not be any negligence with the patient. Your behavior with the patient should be proper. In every visit, you have to give the proper time to the patient. Regarding the prognosis, you should not exaggerate it and you should not minimize it. Most important is you behave the patient with the patiency, with the delicacy, and please keep the all the things with you only. The secrecy should be maintained regarding the any disease or regarding the anything for that patient. Next, duties of practitioner to the profession. As we have seen the duties of practitioner with the patient, he is also having the certain duties with the profession. So first one is upholding. It is not uploading, it is the upholding. Upholding honor of profession. A practitioner of homeopathy shall at all times uphold the dignity and honor of his profession. He should not give the bad words to his profession कि होम्योपैथी ऐसा नहीं करता है, वैसे नहीं करता है, इमरजेंसी में काम नहीं आता है, वो ऐसा किया वैसा. तो this should not use the bad word. You have learned it. आपने अपने मन से ये पैथी ली है, आप अपने मन से इसको पढ़ाई की है. Now this is your duty to treat the patient with your knowledge, with your pathy. पैथी आपकी ट्रीट नहीं, मेडिसिन आपकी ट्रीट नहीं कर रही है, यानी प्रॉब्लम आप में है, वो मेडिसिन में नहीं है. यू आर नॉट एबल टू सिलेक्ट दैट मेडिसिन प्रॉपरली. द मेडिसिन गिविंग द रिजल्ट सीन्स honeymoon time. And so there is no problem in the medicine, no problem in the pathy, the problem in your mind, because you are not using your weapon properly. So you should be always give the honor to your profession. Second, membership of medical society. For the advancement or to get the value addition of the profession, a practitioner of homeopathy should affiliate himself with the medical societies and contribute his time and energy and any progress, so that it is used for the betterment of the society and the betterment of our profession. So this membership is again important. You will also get the knowledge, other will also get some value addition from your cases, and you should give some energy and some time to such society, so that the both way वो होगा, आपको भी knowledge मिलेगा, society यानी medical society को भी आपका knowledge मिलेगा. Exposure of unethical conduct. A practitioner of homeopathy shall expose without fear or without favor incompetent, corrupt, dishonest or unethical conduct on the part of any member of profession. जैसे कोई हमारे इसमें भी रहता है कि दैट फिजिशियन इज डूइंग वेरी वेल, एंड वो फिजिशियन के बाद बहुत सारे पेशेंट्स जाते हैं, आपके पास पेशेंट कम आ रहे हैं, एंड यू विल बिहेव विद दैट फिजिशियन वेरी बैडली, वेरी रूडली. क्यों? क्योंकि आपको जलन है, बिकॉज यू कैनॉट बेयर his success. एक second. Your attitude should be proper with that physician. So you should not show any unethical conduct कि उसको bad words बोल दिए या उसको कुछ भी बोल दिया, उसको उसके साथ झगड़ा कर दिया, because he is having the more capacity, he is treating the more patients than you. So this should not be the attitude. This is totally unethical. Next one is the appointment of substitutes. Whenever a practitioner of homeopathy requests another to attend his patient during his temporary absence from practice, professional courtesy requires the acceptance of such appointment by the latter if it is consistent with his other duties. The Practitioner of Homeopathy Act under such appointment shall give the utmost consideration to the interest and reputation of the absent practitioner. He shall not charge either the patient or the absent practitioner of homeopathy for his services, except in the case of special arrangement between them. All such patients shall be restored to care of the absent practitioner of homeopathy upon his return. So अगर आप substitute किसी को कर रहे हो, so he should not take the money from the patient. हाँ, अगर आपको अपने किसी डेंटिस्ट को वहाँ पे बुलाया है, then it's okay. But if you are not able to treat that patient, or you are out of because of some reason you are out of station, then that substitute should not ask the money from that patient. So this Practitioner of Homeopathy Act is there कि for such profession or for such appointments, there should be the beforehand consideration should be there. The next one is the charges for service to the practitioner of homeopathy. There is no rule that the practitioner of homeopathy shall not charge another practitioner of homeopathy for his services, but a practitioner of homeopathy shall consider it is a pleasure and privilege to give the service to his professional brother and his dependent if they are in his vicinity or the medical student. This is again important. So what they are saying कि we should not take the money or we should not take anything from our प्रोफेशनल फ्रेंड्स. मैं अगर आपके पास आऊंगी ट्रीटमेंट के लिए, सो दिस इज योर ड्यूटी कि आप मुझे मनी नहीं, या फिर आपका कंसल्टेशन फी मैं आपको नहीं दूंगी, या फिर आपका कोई भी फ्रेंड आता है, सो यू शुड नॉट टेक द मनी फ्रॉम योर फ्रेंड, प्रोफेशनल फ्रेंड. ठीक है. सो या फिर स्टूडेंट कोई आता है, इंटर्न कोई अगर फिजिशियन के पास आता है, सो दिस इज वी आर नॉट टेकिंग द चार्जेस फ्रॉम देम. एक फिजिशियन दूसरे फिजिशियन से चार्जेस नहीं लेता है, बट नाउअडेज दिस इज नॉट पॉसिबल. ह्यूमैनिटी सबकी मर गई है, दे आर टेकिंग द मनी. क्योंकि बहुत सारे हजारों डॉक्टर्स रोज ही बाहर निकल के आते हैं, अगर फिजिशियन ने उनसे पैसे नहीं लिए, सो वो फिजिशियन को पैसा नहीं मिलेगा. दिस इज नाउअडेज, दिस इज द एटीट्यूड, एंड दे आर टेकिंग द मनी. बट इफ यू आर ethical, you should not, at least you should not take the money from the homeopathic physician. This is, you should take it as a pleasure कि आपको वो चांस मिल रहा है कि यू आर ट्रीटिंग टू अनदर फिजिशियन, क्योंकि वो खुद को सेल्फ मेडिकेट नहीं कर पा रहा है, एंड ही इज कमिंग टू यू. ही आपने आपको उसने वो लायक समझा कि वो खुद को आपसे ट्रीट कर रहा है. दिस इज योर प्लेजर, दिस इज योर, आपको वो रिस्पेक्ट दे रहा है. सो ट्रीट इट विदाउट एनी फीस. So this is the way we are treating the homeopathic physician or any intern or any student. There is no rule that the practitioner of homeopathy shall not charge another practitioner of homeopathy for his services, but a practitioner of homeopathy shall consider it as a pleasure. A practitioner of homeopathy called in an emergency visit to a patient under the treatment of the another practitioner. When the emergency is over, retire your favor, but shall be to entitled to charge the patient for his services is not the good practice. किसी ने आपको इमरजेंसी में बुलाया है बिकॉज यू आर वेरी सीनियर फिजिशियन एंड यू नो हाउ टू ट्रीट दैट पेशेंट. सो फॉर इमरजेंसी के लिए अगर आपको कोई बुलाता है, एट दैट टाइम यू आर asking, you ask them to lot of money, so this is again unethical. आपको, या फिर ऐसा भी हो सकता है यू आर एक्सटेंडिंग योर सर्विसेज कि एक बार आपको पेशेंट मिल गया, सो यू आर कंटिन्यूअसली ट्रीटिंग दैट पेशेंट, वो इमरजेंसी आपकी खत्म भी हो गई है, स्टिल यू आर पुलिंग दैट पेशेंट टू योर सेल्फ. सो दिस इज नॉट अगेन अनएथिकल. जिस जो काम के लिए आपको बुलाया था वो काम करो और वहां से चले जाओ. यू शुड नॉट एक्सटेंड योर सर्विस, क्योंकि पहले से ही वो एक होम्योपैथिक प्रैक्टिशनर उसको देख रहा है, ही इज ट्रीटिंग दैट पेशेंट. When a practitioner of homeopathy is consulted in his own residence, it is not necessary for him to inquire of the patient if he is under the care of another practitioner of homeopathy. So अगर आपको कोई घर में भी बुलाता है in the emergency cases, then you have to treat that patient वही टाइम पे, आप उसको भी एक्सटेंड आपको करना नहीं है. When a consulting practitioner of homeopathy sees a patient at the request of another practitioner of homeopathy, it is your duty to write a letter stating that we want your opinion in this particular case for the mode of treatment, and पहले मैंने ये medicines दी है, now we want your opinion. सो दिस कैन बी हैपन कि आपको भी बुला सकते हैं इमरजेंसी में, आपको भी बुलाना पड़ सकता है किसी भी प्रैक्टिशनर को. सो एट दैट टाइम बी एथिकल. देन द नेक्स्ट वन इज द engagement for an obstetric case. So this is again a very long topic. So to instead of that, we will take a quick recap of the previous points. In the obstetric case, what they have given, I will take one in short. If a practitioner of homeopathy is engaged to attend a woman during her pregnancy or the delivery, and if you Okay, we will take it later on because this is a longer topic. So we will take a short recap of the previous point. So what we have learned, we took the certain general principles of the physician that he should follow when he is treating the patient and when he is treating in society. So first thing is the oath that we will take at the time of registration, Hahnemannian oath, and the that oath that we have to submit to the registrar. So there we are taking the oath that we will treat the patient as a person. We will show the full humanity. We will keep all the secrecy of that patient. We give the respect to the patient, irrespective of their nationality, race, or the religion, or anything. I will treat my patient and I will give my gratitude towards my teachers. So these are all the points are in the oath, Hahnemannian oath. Then we have seen, after that we have seen the general principles, how what is the character of that medical practitioner, or how he should treat the patient. Then he should have certain morals and the character should be good. Then we have seen the responsibilities of practitioner. He should not advertise his skills. He should not be uh, advertise his list of charges, or he should not advertise the directly or indirectly the manufacturing products also. अगर आपके पास कोई अगर if the same the pharmacy is with you with your clinic, so you should not advertise that. Pharmacy is a different thing. Then कहाँ कहाँ पे आप advertise कर सकते हो? If your practice is new, if you are shifting some another place, if you are absent for some days, या फिर आप rejoin हो रहे हो तब, and if you are changing your address, so at that time you can do the advertisement. Payment of professional service, the practitioner should not be increase or decrease the fees according to the patient's capacity. He should have the fixed amount of fees. लेकिन but these fees are again totally depend upon the community where you are doing the practice. Rich people है तो उनसे ज़्यादा लेना, और गरीब है तो उनसे या रिच पीपल है तो बहुत ज़्यादा लेना, और गरीब है तो उनसे अगर आप कम ले रहे हो सो दैट इज़ अ गुड थिंग, लेकिन गरीब लोगों से भी अगर आप ज़्यादा लोगे सो दैट इज़ अगेन अनएथिकल. Then rebates and commission, this is again important. There should not be any cut practice because this will cut you in very soon or in very short. Then we have seen the duties of practitioner to their patients. If we should treat the patient, or a patient in the sense we are treating the sick, जिसको साइन एंड सिम्टम्स है उसको आपको ट्रीट करना ही है. दिस इज योर होल एंड सोल रिस्पॉन्सिबिलिटी. You cannot terminate your service. The certain points we have seen where we can terminate our service, which we should not show any act of negligence. We should behave properly with the patient with the positive attitude. Every time we have to give a proper time to the patient. If that patient is having the bad prognosis or the good prognosis or certain things that he should avoid, we should discuss with the patient, with the friends or with the relatives. And most important is we should treat the patient with all the patience, with the delicacy, and his secrecy should be maintained. After that, we have seen the duties of practitioner to the profession. We should have the respect, we should show the honor to our profession. We can increase our gratitude by joining the certain medical society. There also we can give our service. We should not behave improperly with our colleagues. Then we should give the respect to our substitute. In case of emergency, if you are giving the service to the another homeopathic practitioner, you should not ask for the money. या फिर आपको भी किसी को इमरजेंसी में बुलाना है, so you should call them without any jealousy. And if you are treating with the homeopathic physician or any medical doctor or any physician, you should not charge them. And in the emergency visit, you have to go and treat the patient properly. Only the engagement for an obstetric cases remain, that we will take tomorrow. Okay. सो रीड दिस इथिकल कोड एंड दिस कोड्स जो है ये आपको लाइफ टाइम याद रखने हैं. That's why I'm taking this. Nobody will ask the question. This is not a very rare question. लेकिन ये frequently भी question नहीं पूछा है. But still you should know as a physician कि how you should behave in the society, how you should behave with the patient. इसलिए मैंने ये chapter लिया है. Okay, read it and if you want to ask, you can ask me anytime.